If you're thinking about medical school, start asking yourself one honest question. Why do I want this? Because medicine isn't just a career, it's a commitment. It's long hours, years of learning, and moments where you're pushed mentally and emotionally. But it's also one of the most meaningful paths you can take, being there for people when they need it the most. This path starts with the foundation. You do well in high school. You'll need to get a bachelor's degree. It does not matter what your bachelor's is in. You do not have to be pre-med. You could have a bachelor's in basket weaving. It does not matter. Nursing's a good option as well to get a bachelor's in nursing. What to get some real life experience on the units. However, you can get a bachelor's in just about anything. The goal is while you're in college to get the prerequisites. That's 2 years of biology, 2 years of Gen Chem, 2 years of organic chemistry, 2 years of physics. Biochemistry, it's wanted at most places. English, math, and one of classes such as psychology or sociology, one of those behavioral sciences. And that's all you need, a bachelor's and those core requirements. These classes will help you prepare for the MCAT, which is a beast of its own. There's a lot of resources out there that help train you for the MCAT. You need to do well. If you need to or you want to get into a US school, you need to do very well. You need well over a 500 on the MCAT to get into these schools in the US. If you cannot get into the MD programs, there's also DO programs in the US, which slightly have lower scores for the MCAT and GPAs, so slightly below the MD, but still in the US. And they are the same thing as MDs, a medical degree or a doctor of osteopathic medicine. They do exactly the same thing. They're physicians. However, doctors of osteopathic medicine do have additional training regarding body manipulation and so on. But at the end of the day, they're both physicians, all right? So don't discourage yourself and say, no, a DO is not as good as an MD. It is equivalent, all right? So the goal is to become a physician, all right? Grades matter, but also does your experience, your clinical exposure, volunteering, shadowing physicians. Schools want to see that you are more than just a book learner, all right? And here's something important. There's no perfect applicant. People come from different backgrounds, different timelines, different struggles. What matters is consistency, growth, and purpose, and that will be reflected in your medical school interview. Now, let's be real. U.S. medical schools are very, very competitive. Not getting into one doesn't mean that you cannot become a physician. It means that your path might look a little different. There is another alternative route, which is Caribbean medical schools. Schools like St. George's, Ross University, and there's many others. These are Caribbean medical schools. You would be a IMG, an international medical school graduate, all right? Again, you are still a physician. Many of the physicians that I have come across in my career in healthcare have been graduates of Caribbean medical schools. However, it is a very competitive environment and you need to do really, really well. It's very, very cutthroat. You have to be a self-learner. You need to be disciplined. You need to be resilient. You need to pass your exams. You need to do very well on your step exams, because if medical schools are limited, residency spots are even more limited. So you being a Caribbean school graduate, you're competing with those that have graduated from U.S. medical schools, medical colleges, and DO applicants, MD applicants. So you need to be very, very competitive graduating from a Caribbean medical school. However, that does not mean you cannot do it. Hundreds and thousands of graduates from Caribbean Medical School have become physicians and have been very, very successful in their careers. So here's the message: don't get stuck on one version of the journey. All right, focus on becoming the kind of person who can handle responsibility of being a physician. Build your knowledge, get exposure, stay consistent, and be honest with yourself about the work it takes. If your reason is strong enough, you'll find your way there one step at a time, all right? You can do this.